Hi, this is Dr. Sanjeev Kumar. In the series of continuing our talk about elderly care and hospice care, let's talk about the components of home hospice care. So, as the name itself is self explanatory, that home hospice means it is done at home, wherever the person is at home, at skilled nursing facility, or at an assisted living place. So, a hospice has basically five major components. The most important component of that is a nurse, a registered nurse or an LPN who goes and visits frequently at the nurse home and checks vitals, reviews medication, looks at the comfort level, adds any medication that is needed for any infection or anything, and then comes the nurse aide. The nurse aide usually visits anywhere from 1 to 5 times a week, and her whole purpose is to provide caregiving in the form of bathing, dressing, cleaning the bed, making sure that all her skin is all right, reporting to the nurse if she sees anything. And in my opinion, a nurse aide is a big help to the family member, especially when people are bedridden and it's tough to roll them or give them a bath. Then comes a chaplain, and it doesn't matter, in my opinion, what denomination or religion a person is. In my opinion, a human being holding hands of another human being has more meaning than any medication I can prescribe. And then there is a social worker who can look at a person's insurance and find out what all can get, say, from, for example, from the Congestive Heart Failure Association. Sometimes locally there are resources available which they can tap into, and they can help you manage decisions down the line. And finally is the doctor. Doctors usually in our country does not go to patients' home. I believe I'm one of the few who goes to patient home to see the patient because that's what I do. So these five are the major component of it, and they meet every week, every 14 days, and they talk about any issues every day. So in the background, this team of people, they talk every day about your loved one and any changes. And then the nurses let the doctor know, and then he or she makes a decision based on that. Later on, we'll talk about more about further hospice care, and thank you. Have a blessed day.